Welcome back. I'm here with Alain Beaudet, the president of the Canadian Institute of Health Research. Thank you so much for joining me.
My pleasure.
What do you consider to be some of the opportunities around building resilient and responsive health systems?
I think we're at a crossroad. I think that countries with a universal healthcare system, which is, I think, the key to everything else, right, are really stretched to the limit. And I think we have to rethink this system if we want to be able to maintain a universal healthcare system. And to do that, I think we do have opportunities. They're technological. I think that the way e-health is growing offers tremendous opportunities to develop new systems and systems that feed back onto each other. In other words, systems that can self-correct using the data that the system generates. And I think this is a huge opportunity. The second important opportunity is to think about health systems, not health care systems. We are a medical society. We think about disease. We don't really think about health. We think about treating patients once they're sick. We have to think of a system that aims at keeping people healthy, and that's very different.
What are some of the key questions that you think need to be researched in the pursuit of a resilient and responsive health system?
I think we have to do way more in terms of prevention and understanding prevention and new ways to dealing with prevention. I think, I'll give you just an example, and again coming back to this idea of thinking health as opposed to thinking medically disease. Think of microbiology. For years, we focused on the deadly microbes, and we tracked them, and we killed them, and we developed antibiotics. Great. Indeed, people are dying less and less of infectious diseases. But what have we done at the same time? We've forgotten all the zillion microbes that are actually responsible for our health, responsible for keeping us in good health, responsible for metabolizing our nutrition or dealing with the environment, ensuring that we're healthy. With the result that we're dealing with not being able to cope with environmental changes, climate changes, nutritional changes. What do we see? We see an increase in allergies. We see defects in the immune system. We see obesity. We see hypertension. We see diabetes. This is what we have to prevent. We need to learn how to look at the factors that promote health and better understand them so that we can prevent diseases. Once you start working with sick individuals, the rationale changes.
You've talked broadly about the actions that you think need to be taken to build resilient and responsive health systems. What specifically can your organization do in that direction?
So we do support health services and policy research. And I think what's great about our organization, and let me brag a bit, is that we're not an organization that's focused only on health services and policy research. We support research in that area, but as an ensemble where we also support biomedical research, clinical research, population and public health research. It's a continuum, which means that when we support population and public health or health services and policy research, we also support interactions between the two. We support interdisciplinary approaches. And we also support the computer scientists that will help these people deal with big data, use artificial intelligence, work us in the new world. So that's really, I think, the strength of our organization that spans all of health research. We strongly promote interdisciplinarity, which indeed is critical if we want to find new solutions to issues of health systems. Health innovation is key. Evidence-based practice is key. The next challenge is knowledge translation. How do we implement research results into the system? How do we use research results in an effective way? And that's the entire new area of implementation science and delivery research, where we've been investing a lot in the past few years, because we feel that it is critical to make sure that we can actually make a difference, that the research results are disseminated properly taken up and integrated into the system.
Well, that's great. Thank you so much for your time.
Pleasure.